What happened between 2014 and 2018 in our country? The only major change that happened was that we all started carrying devices on us 24/7 that connected us to every human on the planet. And while the internet is an exciting place, it's still a jungle. Jungles have delicious fruits and wonderful trees, but they have snakes and dangerous animals. The fact that we released something onto the public that is having an adverse effect on 20% of the population, we would never release a medication like that.
Hello, Heal Squad. Welcome back. We have another incredible episode for you guys today. And parents, you are going to want to hear this one. We are joined by one of the most brilliant and trusted voices, Dr. Harold Koplewicz. He is the president of the Child Mind Institute, a best-selling author, and a relentless advocate for families navigating the youth mental health crisis. I think we can all agree that our kids are struggling and we can't afford to ignore it. But before we begin, our quote of the day: parents are still the most influential factor in a kid's life, but it's important that kids keep talking, keep sharing their viewpoint, and not backing off because, it's important that parents keep talking. Funny enough, guys, we were just chatting about how our kids are chatting a lot. My daughter, his granddaughter. Anyway, it's important that parents keep talking, keep sharing their viewpoint, and not back off because their kids say everyone's doing it. And that is from Dr. Harold Koplewicz himself. Welcome, Doctor, to the show. Thanks for being with us today.
Oh, it's my pleasure. And it's always fun talking to you, Maria.
Thank you. Thank you. Well, I am really excited. I think that mental health is a really, really important topic, obviously, just in general, but obviously, if we can get them young and help them, I think that that is the most important at this time. So, why is suicide now the leading cause of death among young people?
So I think first and foremost, young people are not supposed to die, right? And so the things that will kill someone my age or kill someone your age, whether it's heart disease or cancer, very rarely occur in young people. So the number one cause of death for young people between the age of 10 and 24 is accidents. And number two has become suicide. And the reason for that is that infectious diseases have essentially disappeared. The most common illnesses of childhood and adolescence are mental health disorders.
Wait, infectious diseases have disappeared?
As far as killers for children. Do you know they don't die of mumps, measles, German measles, chicken pox,
Got it.
Polio. So vaccines have essentially eliminated the death of children from infectious disease.
Okay.
However, if mental health disorders are the most common disorders of childhood and adolescence, one of the bad outcomes of a mental health disorder untreated may be that a child will take their own life. It's hard to even say those words, but when kids feel incredibly hopeless, not necessarily depressed, but totally hopeless, that's when they do things, particularly teenagers, do impulsive things that may result in either a suicide attempt or suicide itself.
So what ages, you said teenagers just now, what ages are you seeing this be prevalent in?
So the most dangerous time for a suicide and the most common time for a mental health disorder is really at the start of puberty, which could be 11, 12, sometimes as early as 10, all the way through the age of 24. That's when adolescence ends. It doesn't end at 18 or 19. It's almost as though the people at the car rental places like Hertz and Avis figured out that something is going on in the brains of these kids that they won't rent a car to someone under the age of 25, right? They could make a lot of money renting between 18 and 25, 24, and they don't. And that's because the prefrontal cortex, this part of the brain behind your forehead, doesn't connect to the rest of your brain until you're 24, 25, sometimes as late as 27 for boys. And what does that mean? That means that at that point, your brain starts to figure about cause and effect. If I don't put a seatbelt on and the car's going fast, I might hit my head. If there's an accident, I might get very badly injured. If I'm going to get onto a bicycle or a motorcycle, I better put a helmet on. If I'm going to have sex with someone, I better put a condom on because I might get them pregnant, or I might get a venereal disease, or I might get pregnant. Do you know what I mean? All of that starts coming into play as your brain gets more mature. And that's really the end of adolescence. And that's when we start seeing a decrease in suicide rates. We start seeing less of an increase in mental health disorders after the age of 24. But it's between, that 12 or 11 and 24 where most of these disorders start showing up, whether it's depression, anxiety disorders, even schizophrenia, bipolar disorders. That's when the brain is the most vulnerable and sensitive.
And what do you think is contributing to this rise?
Well, I would tell you that I think it's more about mental health awareness, us being definitely better at screening, that pediatricians are talking to parents, are looking at these things. So think about it. If the most common childhood and adolescent disorders are mental health disorders, the first line of defense is your pediatrician. So when your pediatrician sees you, I mean, they're very overworked pediatricians. They basically get paid for 7 minutes of face-to-face time because, the reimbursement rates for Medicaid, Medi-Cal, and even health insurance for pediatricians aren't very high. And if they ask too many mental health questions, they might find themselves going way past the 7 minutes, right? Because they
Oh,
want to check your
yeah.
heart. So
That was the first thing I thought of when you said that. I'm like, where do they have time to even get into this? Like, they
Well,
gotta check
but
their
Marie, if
weight, check their this, check all that. Like, we don't have
so
time.
sometimes they let the nurse do it or their assistant. But the thing that bothers me is that if they ask a teenager, so have you had a lot of bad moods lately? If the teenager is honest, they say yes, and then we're off to the races, right? So you have to figure out, is it just moodiness or is it real depression? Is it anxiety or is it just angst? And one of the things we've been working on at the Trauma Institute is helping pediatricians get screeners. So while your mom and the patient are waiting in the waiting room, give them an iPad and ask them some questions so that if there's any red flags, that's what you attack. And if there aren't any red flags, that means you can go on to examining the belly or, asking them, their allergies. But it has to be, we have to get to the point, Maria, where mental health is as equivalent to physical health. I always remember that when I went to elementary school in a New York City public school here in Queens, we had a gymnasium in the school, but we didn't do gym. We did square dancing. Now, I actually thought that was a false memory, but I actually reached out to someone I went to fifth grade with, and he said, yes, we did square dancing. And to make matters worse, we didn't even put on sneakers. We all walked, we scuffed up the floor, and the janitor had to buff the wax the floor 2 or 3 times a week. And then President Kennedy became the president, and he said, we are going to teach kids how to do sit-ups and push-ups and jumping jacks. And by the time President Johnson came in, we had to run a mile and we had to climb a rope. So physical fitness has become part and parcel of our educational system. And for people who are 40 and under, I will tell you that most of them, if they're not exercising every day, feel bad that they're not exercising every day because they know that physical fitness is part of prevention. It makes you healthier. We need to do that with mental health fitness. We need to have kids so they're comfortable being able to do mindfulness, that they can understand their thoughts, manage emotional stress, understand what a relaxation skill is, understand their feelings. And those 5 skills have to be taught differently to kids in elementary school and differently to kids in middle school and in high school. But it should be just as important as being able to do a push-up, a plank, a sit-up. And therefore, it may not prevent full-blown anxiety disorder, but it'll certainly get someone to intervention sooner because they'll have that literacy. We were talking earlier about how girls particularly have early language development. Well, if you can get your child to say, I feel bad. And what do you mean bad? My tummy hurts. I feel my head is spinning. That they describe to you an anxious, physical feeling, and you help them with, well, what do you do when that happens? Can we try deep belly breathing? And they know it's the default. They immediately know how to fill their belly like a balloon and then let the air out. And if they do that 10 times, that they start to feel better. That's a wonderful trick, right? It's kind of
No,
like
I love
stretching.
that.
When
I'm
you're
going to keep
tight,
doing that.
you're sitting up like this, and afterwards you figure if I lie down on the floor and do some stretches or get up against the wall, we just know how to take care of ourselves instead of letting that tension keep building and those worrisome thoughts that kids can have that interfere with attention, with focus, with enjoying, by the way, the school day, which is not only the academics, but the social aspects of it.
I really love that. And I want to get into some of these tips because I know as we were chatting about my daughter, she's very vocal. She knows how to tell us what she wants. She even noticed I had this cut on my arm and she said, you have to put Briotech. And Briotech is this like antibacterial spray
Right.
that we have. And I was like, my God, she's already diagnosing and prescribing. That's hilarious. But
But more importantly, Maria, she's also showing remarkable empathy. A
yes,
remarkable empathy. Should That's what we want for our kids. We want them not only to care about themselves, but to care about others. And she's
yeah,
not getting flipped out over it. She's just
no.
saying, my mom knows how to take care of me, and therefore it's very, by the way, your daughter's extraordinary at 2 to be able to do that, but that's what we want for our 5-year-olds, our 6-year-olds, to be
Yeah,
able to say, I want you to care for yourself, mom. I love you. I
yeah.
want you to care for yourself.
I know. I literally fell off the chair when she told me that yesterday. But what I love is at this point, because she is at that place where I think we could explain to her, 'cause she says, Athena's smiling, Athena's happy. And so I think I'll start to teach her. She knows hurt too, because she'll say, I hurt when she hurts her knee or something like
Right.
that. But I love those tips and I want to get to them. But first, I still want to get to kind of why are we here? And, when I hear you say we have to teach them how to, breathe and all these things and how to basically self-regulate, your generation, no one taught you that stuff. Like, because I'm sitting here thinking this should be in the curriculum in schools, obviously. But no one taught the generations past this stuff. We weren't having these suicide rates before. What has happened? To me, I think screens have been a massive contributor. And everything that I've learned about blue light killing dopamine and all of that, and the fact that we are now indoors and not outdoors, we're not getting any sunlight. The sunlight is energy, it's information, it's healing. I look at all of those elements and I think that that is a massive contributor. But I wonder
So I
for you.
think, Maria, we have to be careful about cause and effect and correlation. So I am a firm believer that social media is bad for kids. It is particularly bad for kids who have a mental health disorder. So 20% of the population has a mental health disorder. They don't all get help, but 20%, 1 out of 5, that's how common it is. So how do I figure that? How did I come to that decision? Well, between 2014 and 2018, suicide rates went up dramatically. They went up by 50%. I'm sorry, 20%. We went from 5,000 deaths to 6,120 deaths among young people between the ages of 12 and 24. The number of kids who made attempts or had severe suicidal ideation that required them going to an emergency room jumped from 600,000 to 1.2 million. So one every 30 seconds, a kid was showing up in the emergency room. So that's dramatic. That's dramatic morbidity. Those are the suicide attempts, and mortality. Those are the suicide completions. What happened between 2014 and 2018 in our country? Did the water supply chain change? Did we add something to the water? Did we change the telephone wires? The only major change that happened was that we all started carrying devices on us 24/7 that connected us to every human in on the planet. And while the internet is an exciting place, it's still a jungle. So, jungles have delicious fruits and wonderful trees, but they have snakes and dangerous animals. And the fact that we released something onto the public that is having an adverse effect on 20% of the population, we would never release a medication like that. Do you mean? So now it's been released. The government seems to be very, very shy on or reticent about regulating it. The platforms don't seem to want to regulate themselves because they're profit-making entities, and so it's left parents and schools and responsible adults to intervene and say, don't give a phone to a child till they're 13. You arbitrarily say 13, even though there might be some kids who could do it at 11 and some kids who shouldn't have it until they're 15. But the second piece of data, which I think is really important, is that during COVID, we created something called problematic internet usage. We found that there was a group of kids who started using the internet, gaming, just scrolling, just staying on the internet 6 to 8 hours a day. And for many of those kids, you couldn't take the devices away from them without having distress. And we knew that if you didn't have a mental health disorder, you slept less, you exercised less, and you had less real life interactions. But since the Child Mind Institute had done a study beforehand called the Healthy Brain Network, where we had 8,000 kids that we had interviewed, we had done functional MRIs on them, EEGs, neuropsych testing, so we could clearly tell you that 90% of them met the diagnostic criteria for a mental health disorder, and 10% didn't. We were able to compare and we knew how much internet they were using before COVID. We could show you that if you had problematic internet usage and you did have a mental health disorder, not only did you exercise less and have less real life interactions and sleep less, your symptoms got worse. You became more anxious, more inattentive, more depressed, more socially isolated if you had autism. So we have two pieces of data that, the former Surgeon General was looking at, showing us that this has had a negative effect on a large percentage of kids. And so that's one piece of data. I think the second piece of data is COVID. So whether it was intentional, unintentional, it doesn't really make a difference. We had a terrible epidemic. We didn't know what to do. We knew crowds were bad. We kept kids out of school. And so there was a group of kids who didn't do badly during COVID because basically they liked hanging out with their mom and dad. They didn't, the challenges of social interaction were difficult for them. And parents also started to recognize that their kids may have some problems. All of a sudden they saw how inattentive or how hyperactive. But all of these kids lost academic time and they lost social time. And then when you sent them back to school, certainly the anxious kids really had trouble. They were okay before, and now they were faced with having to stand up and talk in front of others. They had to separate from mom and dad. And so we can't be childlike and say, oh, they're just going to catch up. We have to recognize that academically there's going to be a slowness that's going to have to take time, whether it's remediation, whether it's more school, none of which we've done. And we have to recognize that it was damaging psychologically for a certain percentage of the population. So I think you have two pieces here of social media, which I don't care how good it is for certain groups who feel socially isolated. Overall, it's a negative. And we then had, a worldwide pandemic.
Yeah. I think that being connected to everyone in the world was such a false sense of connection that everyone felt connected, but then they didn't realize how disconnected they were becoming. And so I think that didn't help. But Before we continue on, friends, if you didn't know this about me, I love the 4th of July and the fireworks and the food. It's definitely one of my favorite holidays, and I know Athena is going to have so much fun this year. And just in time, Macy's is coming through with their epic 4th of July sale where you can get 20 to 60% off everything you need to celebrate, from grilling must-haves to cute summer staples like your swimsuits and beach towels and all the adorable red, white, and blue things that you need to make it look like the 4th of July. I just found a really cute Michael Kors mix and match set in red, white, and blue, and I'm going to throw on some breezy linen. Uh, well, it's a breezy linen dress, actually, that I'm going to throw over it to stay cool and festive. But you can check it all out on my Macy's wish list in the show notes below. Trust me, it'll give you all the inspo. So shop all things red, white, and blue with Macy's from July 1st through July 6th at your local Macy's or online at Macys.com. Happy 4th, everybody. False connection. And it's not just social media. Have you guys done any research into screen time in general and
Well,
what that's doing to dopamine levels?
so that's the point. We don't call it problematic social media use. We actually coined it problematic internet usage.
Got it.
And for some people, it does feel like an addiction, by the way. They
Yeah.
cannot stop, and for most of us, putting away our phones is really a very good exercise. Um, I find myself, it's like a bad movie. You walk into a restaurant and a family is sitting at the table, and the children have headphones on, and they're watching, a cartoon, or they're watching, Netflix, and the parents are looking at their phones, and you feel like going over to them and saying, "Do you know who I am? Stop. This is bad parenting. 20 minutes, you should be able to figure out a way to connect to your kids. And if they're 2 or 3 and they're not big talkers, then let's get some paper out and let's color together while we wait for the food. Or let's figure out how to teach our kids, by the way, to have a conversation." And not every child is like Athena. Most children, by the way, need to be taught how to have a conversation. It's kind of like a tennis match. The ball has to go
Yeah.
back and forth. You teach your kids, why don't you ask 3 you questions?
Three you questions?
Yes, everyone loves to talk about themselves.
Ah,
Maria, where do you live? Where did you go to school? Do you have children? What's your favorite color? And they recognize that there's a reciprocity, that after they ask the question, the other person should ask the question back and forth. And if they're sitting at a table and they ask 3 questions to the right, then they ask 3 questions to the left. And by the way, I think some of this has to be taught. I think some kids don't know how naturally to shake hands. That,
yeah. Oh, I taught Athena that too.
right, it's a puzzle. You want to make sure it's not too hard, but it's not too soft. And you want to look someone in the eye, excuse me, long enough so you can tell me the color of their iris. I mean, now there are certain kids who just get it or do it, and there are others who, with that, will help them become more socially connected. And if they, by chance, have social anxiety, that they're somewhat pathologically self-conscious, these are the tricks and tools that make it easier. Just think what it's like to go into a party, a cocktail party, and you think to yourself, I don't know anyone, I'm not wearing the right clothes, who's going to talk to me? People who do not have social anxiety, I'm one of them. I walk into the room and look around and say, who am I going to talk to? Do you mean it's a different mindset? But most people are uncomfortable. And by the way, what do? They go get a drink. The alcohol really works. It doesn't work long term, but in the short term, it takes down your anxiety and you feel a little more comfortable, and you find someone who's wearing similar clothes to you or has similar thoughts as you do, similar career, and you start to chat. Well, if you're a child who has that, how is we as parents can make it better for them without encouraging them to have a drink, So
Yeah.
we want to give them tools in the same way that we read to them. Reading to your kid is a wonderful idea, not necessarily to teach them how to read, but the idea of calmness, listening to a story, asking their parents questions about the story, spending the 5 or 10 minutes to get through the book. Um, that is an important skill. So are these social skills lessons as well.
Yeah, I wonder if you have a child that isn't speaking yet and your friends' kids are speaking. What do you do?
Well, I think there's a level of when we should be worried, right? Um, typical children, typical, uh, have their first steps by the age of 1. They have their first words by the age of 2. By the time they are 2, in fact, we expect them to have 100 words. By the time they're 3, we expect them to have 1,000 words. In fact, the acceleration of language development between 2 and 3 during that 1 year is going to be the most dramatic acceleration for the entire your entire life. You're not going to have, thousands of new words at 22 till the age of 23. I mean, that just doesn't happen. However, development is not always linear. There's spurts. But if a child is at 2 and doesn't have any language and has no way of communicating, so they may not pronounce the words correctly or they might not be articulate, but they're able to communicate with you, that's good. But if you see that they're just unable to socially join, now what do I mean by that? The next time you're on the phone, notice if you're going like this while you're talking on the phone. No one sees you shaking your head, but you're socially joining with the person on their other end. Maria is socially joining with me right now by shaking her head up and down.
Mhm.
We do it naturally. Kids who are on the spectrum, kids who have autism spectrum disorder, lack that ability to socially join. So they're not good at looking at your eyes. Their language may be very delayed. And those are warning signs. That's when, by the way, I would go to see a pediatrician or see a developmental psychologist to say, do I have something to worry about?
Yeah.
Because my friends' kids have 100 words or 1,000 words, and my son or daughter is really having a lot of trouble and also has trouble connecting, looking me in the eye, letting me hug them, showing me some reciprocity. And that worries me. And the reason why you do that early versus late is that the earlier you get to, the brain is developing. Remember, I talked about 24. You have the best prognosis for all of these conditions if you get to it early. Just think of it as a rash. That a rash that quickly gets taken care of doesn't become infected, doesn't become a big deal. All of these things, if we're open-minded and we're not worried about the implications or the guilt or the shame, and we say we're more concerned about our child, I'm going to check this out. And the worst thing that happened is that I wasted some time and I was told this is normal development and things will be fine. Don't hesitate if you have a concern. I trust mothers more, frankly, more than dads, because moms traditionally spend more hours with their kid. If a mom has a concern, she should really lean in. Go to childmind.org and get more information. Go to your pediatrician. Ask more questions. If you're still not satisfied, go see a mental health professional to get more information.
Okay. So going back to screen time, how should parents navigate that? For me, when I go places with Athena, my first thing I tell everybody is she doesn't eat sugar, she doesn't eat processed food, and she doesn't do any screens. So people shut TVs off. By the way, we're a family, we had TVs in every house. They never go on. Never.
Right.
We never watch anything because we don't want her to watch. But I kind of just let everybody know like this is how we kind of do things.
And by the way, are they shocked? They are accepting of your decision on how
Mhm.
to parent and usually very respectful of that. So
Yes.
even if they disagree during the time you're with them, and by the way, I had an interaction with my grandson whose name is Jackson, and I wanted to show him a little video about Jackson Pollock, the artist who did those drip paintings. There's a
Mhm.
great little video, and he's not using a paintbrush, he's dropping. And my grandson said, I'm not allowed, because I was going to show him on my iPhone. He said, Grandpa, I'm not allowed to look at screens. So
No, he
he
didn't.
did. He was 6 years old. I'm not allowed to look at screens.
Oh
So,
my
so
gosh.
I said, you know what? I'm ready to talk to your dad and mom about this later. This is only 1 minute. Grandpa rules. I'm in the house. You could
I'm
just
dead.
quickly look at this. And he looked at it, but you could tell it made him uncomfortable because his mom and dad made it very clear that screens are not good for him. And
Hmm.
I think that, whether I was right or wrong, that my son forgave me and my daughter-in-law forgave me and said I got it. But in general, no TV, don't let him look at the laptop. If he's going to watch a movie, we should know when he's watching the movie, what is he watching? And it's a big deal. Do you mean it's not
Yeah.
just a babysitter?
Yeah, I mean, we have she has seen the phone because when we travel, we've had to FaceTime.
Right.
My husband was on the East Coast, I was on the West Coast, so they FaceTimed and had breakfast and meals together. So she's had a little bit of screen time for that. Sometimes I offset it with a red light so that she's not getting so much blue light. But but as a general rule, there's no TV, there's no Miss Rachel, there's no, am I going to get canceled for saying no Miss Rachel? I saw
But for
somebody
you
get
made that
canceled.
decision for the time being, right?
For the time being, like, listen, I keep saying I'm leaving the window open for anything to be possible because I can, I don't
But
know.
but I think, Maria, I think this is really an important conversation. You are basing your decisions on the information you have and on your beliefs.
Yes.
My son and daughter-in-law really feel very strongly about how the kids can get lost in the screen.
Yep.
My grandson is obsessed with basketball. When the basketball season is going on, his father prints out for him on, the printer in the house, all of the standings from the night before. And therefore, he gets that piece of paper and he's reading it and looking at the statistics. And I find it very amusing because I'm not into sports at all. And I'll say, how do you know the Trailblazers are not as good as the Knicks? Grandpa, look at the statistics. But,
Wow.
so this is really important for him, but they're not going to let him have the phone to look at it because they're convinced, and they're right, he's going to start to scroll. It's really good. You can get down a rabbit hole. Oh, I'm going to learn more about this player, that player. But their belief is that if he cares about the sport so much, they'll give him this piece of paper that he can look at. And by the way, breakfast happens, you stop, and then you go off to school. You're not taking that piece of paper
Yeah,
to school. At school, there are other things to pay attention to. And this is a very seductive device, the screen. I mean,
it is.
it's made to keep you on longer and longer. For any of us who've gone to look at YouTube, you could lose 20 minutes so easily. Do you mean,
Oh
even
my
if
gosh,
it's just,
everybody does. If you look
like,
at
what did
someone's
I just
screen
wait?
time
Yeah,
on their phone, you see it's hours
right.
of just scrolling. And that's the thing is like,
It's pure cotton candy. It has no
I can
nutritional
tell the
value.
difference between a kid that doesn't do screen time and a kid that does, because the kid that doesn't is engaging with me. They'll look me in the eye, they'll talk to me, they'll play outside. And I'm not criticizing anybody because I also believe people only know what they know.
Right.
Everyone's doing the best that they can with what they have. And it's just really, really hard out there. So I'm not here to criticize anybody. I just can tell the difference. And I can see why Athena is engaging with all of us and having conversations with us. We're all sitting down at meals and we're chatting. And I mean, she's the star of the show, of course, but I got to figure out whether that's going to be too much at some point because the world can't revolve around her. But but I think like I'm just, I'm trying as much as I can to have her grow up in nature and outside and not connected to these devices that are giving us false connection so that you could just, like you said, you go deeper and deeper into these worlds and you stay away from the real world.
But I also think that parents need support from not only other parents, but from school. So, for instance, if you make a decision that your child's not going to have a phone until they're 8, 9, 10, 13, whatever decision you made based on the information, it's really important that the school back you up. So, for instance, I think California and New York have both made a very good decision. There are no phones during the school day.
Oh, wow.
Kids come into, they were talking about public school. You come in, you take the phone, you give back the phone at the end of the day.
That's great.
There is no reason for a child to have a phone during the day. It's distraction. Forget about everything else. It's distracting. Whether they're looking at good content, neutral content, or even bad content, it's distracting. And I will tell you that parents have gotten so used to the ability to be in touch with their kids. They'll say, but what if I need to talk to my child? Well, if it's an emergency, there's a phone in the general office. You will call and they'll go and get your child. But I want to know how he did on that test. Well, you'll wait until he comes home. I mean, we've gotten so used to this instant connection, and the parent doesn't realize how incredibly bad that is for the kid. That this hovering business of, I have to know, I have to protect, I have to, instead of delay of gratification.
Well, you're teaching them that they can't have delayed gratification. You're just
well,
teaching them what you're doing. Yeah.
right, but I think parents have gotten used to it. We have a program here during the summer for 4 weeks for kids who have very severe ADHD and some other social problems. We get around 60 kids, some of them from all over the country, but mostly from the New York metropolitan area. And it feels like summer day camp, right? We rent out one of the private schools, Allen Stevenson, and you get there at 8 o'clock in the morning, you stay till 4 o'clock, and they do all the things that you typically do. However, there is almost one counselor every one kid, but there's tremendous amount of feedback, right? 2 points for good listening, -5 points you used your hand and you touched the other child when you weren't supposed to. So you're catching the kid being good and you're giving them consequences if they do something that's truly off task. At the end of the day, they go to a prize room and they've collected all these points. And if they have 100 points and there's something they want to buy for 200 points, you will even say, why don't you just wait till tomorrow, put it on hold, and your points will automatically double tomorrow morning. It's kind of the marshmallow. If you wait, you can get 2 marshmallows. If you eat the marshmallow right away, you only get 1 marshmallow. So delay of gratification is not something every kid knows how to do. And as parents, we have to monitor that. And we have to show them, by the way, not when they're 2, but when teenagers don't hear from their parents how hard their parents are working, not just the hours, but the frustration, not everything goes your way. Do you know what I mean? Not every deal happens. Not every patient has a great outcome. Not every budget works out. And sharing that, it didn't work out the way I wanted to, but I'm going to try tomorrow another technique, or I'm going to go another way. Those kinds of examples of endurance, of perseverance, are very important for kids to see. And then also success. I mean, I firmly believe that if a kid works really hard and gets a C for the marking period, you need to celebrate the effort, not celebrate the fact that it was an easy A.
Interesting. I don't know. I mean, I'm thinking back to the only C's I got were in math. I really tried so hard, Doc. Like I really tried hard, but you know, it
So
wasn't my,
Maria, I had an experience 30, I'm trying to figure out how many years ago, maybe 35 years ago. It was summertime in New York City, and my wife and my kids were away. They were actually out in the Hamptons. I had 3 sons, and the youngest son was maybe a year old, and I had dinner with another summer bachelor. And in passing, he said, so and so, he's such a wuss. I said, why would you say that? Oh, he works for Solomon Brothers for the last 10 years. I said, he must make a lot of money. And he said to me, mind you, this is 35 years ago, at best, Harold, he makes $400,000. $400,000 seems like a lot of money, right? It's a lot of money today. And I was thinking, I am the youngest chief of child psychiatry in the country. I am really near the top of my game, and I don't make $100,000. Do you know what I mean? It's kind of like, does he know how little money I make? And while I'm listening to this, he says, so-and-so, he works for Drexel Burnham, and he makes $1 million a year. And this guy can barely put 2 sentences together, and he makes $2 million a year. And I was thinking, does everyone make $1 million a year? Am I the only person who doesn't make $1 million? Did they rip the pages out of my book? Did I miss the day at school where they were teaching people $1 million? And I'm like completely, and I'm trying to be cool while he's talking to me, but I must have twitched or something. And he actually said to me, Harold, you can't compare yourself to these people. You're just a doctor or just a physician. I thought, just a physician. So I was so unnerved that I remember I was walking home on Madison Avenue. I was on 91st Street and I was walking down to 90th Street. It was a beautiful evening. And I'm thinking to myself, does everyone know I don't make $1 million? How did I mess up? All of a sudden the number was so important. And walking up the street, was Paul Newman and Joanne Woodward. So for your listeners who don't know, Paul Newman was one of the most famous movie stars of that time, right? There, certainly 30 years ago. Butch Cassidy and the Sundance Kid, The Sting. I mean, this was a very, very famous.
Paul Newman was Hustler too, right?
Right. And,
Yeah.
and Joanne Woodward and him were this glamorous, wonderful couple. And I'm too cool to say hello to them, right? I'm a New Yorker. And as they're walking up, they say to me, it's so good to see you. I said, well, it's wonderful seeing you too. And what a glorious night. We're so lucky to live in New York. I said, yes, we are. And this neighborhood is wonderful. And I said, you're absolutely right. It's a beautiful night and you both look great. And he says to me, you look good too. And I'm thinking, he must be mistaking me for someone else. But as we walked away, instead of being super excited that two of the most famous movie stars of their time thought they knew me, all I could think about was that each one of them was making more than $1 million a year. And so when I talked to my wife about it, I called her and I said, so-and-so's making $1 million. And my wife said to me, you love being a child psychiatrist. If you really want to make $1 million a year, you got to go figure out, do you want to sell real estate? Do you want to do something else? And we'll figure out something else. But you're not going to make $1 million a year if you want to be a child psychiatrist, particularly if you want to stay in academics. And she was very funny. She said, there must be, a Valium in the a tranquilizer in the medicine chest. You'll feel better tomorrow morning. And what it taught me, though, was that if I could be so unnerved by what the accomplishments of others were feeling, just think what it's like to be in one of these bubbles, whether it's a New York bubble, a Beverly Hills bubble, a Chicago bubble, or even a bubble somewhere in a rural area where everyone seems to be so accomplished, where everyone either has an Academy Award or now has $1 billion or has a PhD. And
or everybody has a boat.
Right. And you are struggling. Every day at school is really hard. And if your parents aren't taking over and saying, I really appreciate your effort. I see how hard you're working. You work with that tutor. I'm so proud of how hard you're working, so that when they do get the C, that it's not that they're just, people say, oh, don't give ribbons out for everybody who participated. You're giving this kid the prize of your attention and your recommendation and
encouragement.
Encouragement because of their perseverance. And it's not to say that the kid who gets an A very easily should be ignored, but it's not as much effort. You were getting C's in math, but you were gliding on the other stuff because, it worked for you. Your brain worked and it was working.
Yeah.
And I think parents really have to think about that, how easily, and particularly with social media, we can compare ourselves to the rest of the world. There's always someone skinnier, someone more beautiful, someone smarter, and certainly someone richer.
Yeah, no, for sure. But it's also such a great example of why we have to help kids with their mental health early on, because if you at that point were a child psychologist and you were so well studied and it was already rocking you, something like so simple just started to rock you, imagine how challenging it is in these times where comparison is a constant and just literally in your face at all times. I want to wrap this episode right here. I want to come back tomorrow with Dr. Koplewicz, guys. He's going to share the questions every parent needs to ask their child each week. That could help reveal what's going on beneath the surface, things you might need to know if your teen is in crisis or showing signs that they're struggling. We will go through those. And then I also want to go through, we didn't get to it in this episode, but what some of those exercises are that we can teach our kids to help them self-regulate. I think it's good co-regulating, but we'll get to that.
And we could also talk about how early we teach those skills
Yeah.
and how we modify them as a child gets older.
I love it. So, friends, if you loved this episode, if it helped you in any way, or if you think you have a friend who needs to hear any of this, please share it with a friend or two or 10. In the meantime, come back with us tomorrow. Be nice people, make good choices, and be present. Hey, Heal Squad. We have been on quite the journey together, and we're hearing from so many of you just how much this show is helping you heal and get better, and it makes us feel so good. We love, love, love it, and we just ask that you don't keep it to yourself. Spread the message and share the show or your favorite episode with your friends. And if you want to help us even more, you can leave us a 5-star rating and a comment on Apple Podcasts or Spotify, and follow us on Instagram at Heal Squad. You can also DM us anytime because we love connecting with you. And finally, you can also join us on Patreon for our monthly live heal events with world-class healers and ad-free episodes exclusive only to Patreon and our Super Heal Squad for as little as $10 a month. So go to patreon.com/Heal Squad to join. Getting better isn't easy, friends, but as I say all the time, it's a whole lot easier if we can do it together. We love you all so much, and we love doing this thing called life with you.
This podcast and all related content published or distributed by or on behalf of Maria Menounos or MariaMenounos.com is for informational purposes only and may include information that is general in nature and that is not specific to you. Any information or opinions expressed or contained herein are not intended to serve as or replace medical advice, nor to diagnose, prescribe, or treat any disease, condition, illness, or injury, and you should consult the healthcare professional of your choice regarding all matters concerning your health, including before beginning any exercise, weight loss, or healthcare program. If you have or suspect you may have a healthcare emergency, please contact a qualified healthcare professional for treatment. Any information or opinions provided by a guest expert or host featured within website or on company's podcast are their own, not those of Maria Menounos or the company. Accordingly, Maria Menounos and the company cannot be responsible for